Hi, Agul. How are you doing today?
Good, thanks.
For many Canadians, getting a blood pressure check has always been just a routine part of going to the doctor. But a new report from Hypertension Canada warns up to half of the country's baby boomers have high blood pressure or will develop high blood pressure in the next few years. It's a preventable condition, but left unchecked, it could have a dramatic effect on Canada's healthcare system. In Canada, the first wave of baby boomers has already turned 65, and 2.2 million of them already have high blood pressure. Doctors warn that's just the tip of the iceberg as our population ages. Dr. Beth Abramson is a well-known cardiologist and the spokesperson for Hypertension Canada.
Hypertension or high blood pressure should be a wake-up call for all Canadians, but especially baby boomers, because almost a quarter of baby boomers have hypertension or high blood pressure, putting them at risk for heart disease and stroke. What's more concerning is that 23% of baby boomers are at risk with pre-hypertension. In other words, they're on their road to having high blood pressure. The good news, however, is that hypertension is preventable and treatable.
Despite the fact it is a preventable condition, the numbers of Canadians with high blood pressure are climbing dramatically. Estimates show that 7.3 million Canadians have hypertension, up from nearly 5.8 million just 5 years ago, a 26% increase.
High blood pressure is preventable. We can affect our risk and lower our risk of dying by increasing our physical activity, watching the salt in our diet, making sure we're maintaining a healthy body weight, and going and getting our blood pressure checked.
The impact of hypertension is so significant that the World Health Organization has declared it the major focus on World Health Day this year. High blood pressure is responsible for the deaths of 9.5 million people worldwide per year. Across Canada, there are differences in the rates of people with high blood pressure, and Hypertension Canada is calling on the government to help change that.
Part of this is related to lifestyle choices we all make, but Hypertension Canada is asking the government to make a commitment to increase the health of Canadians by increasing the access for healthy foods from coast to coast and lowering the salt in what we eat.